When I say neonatal mortality is showing a trend towards going down, when we're saying increase in antenatal care and immunization, these are very tangible. And if you survey Nigeria, not pundits that are sitting in rooms, but actually ask through People's Voices survey that we have done in 2023, 24, and 25, we see Nigerians also appreciate that. Is it solved? No. We cannot solve, let's say, in just 2 years, what have been long-standing issues of underinvestment and structural defects in the Nigerian health system. But what I am sure people appreciate is that there is a steady move towards improving the health system that we have, and we need to rally around as a country and deliver on that. The third pillar that I had mentioned is unlocking the healthcare value chain. Now, Shun, before we came, we had been very import dependent on almost everything. 4 days ago, in Ogun State, the first dual active ingredient insecticide manufacturing plant, the groundbreaking took place in Nigeria. 2 years ago, you would say it was impossible. Even last year, someone would say it is impossible. This is the first time that such a latest technology that will produce bed nets, that are dual active ingredients that will help us deal with malaria. More than 1 billion nets have been distributed all over Africa, none produced from Nigeria or from African countries. Now we have that plant here. There are many of those that are beginning to happen. So it's not, it's very tangible. You can go and see the plant. Rapid diagnostic kits, pharmaceutical plants that are expanding. There are tangible things that are happening. On the fourth pillar, well, in health, when there is bad news, oftentimes that's what takes the day. When there is huge cholera outbreak or meningitis outbreak or measles outbreak, if you notice in the last 2 years, those outbreaks have been minimalized because the CDC, the public health system, together with states, have been very vigilant in surveillance with the support of our partners, testing quickly whenever there's an issue. There are many scares that happen. We quickly rally around, look at it, try to contain them before they expand. Those are successes, but they are successes in terms of the badness that we did not allow to propagate. Even when there was diphtheria in 2023, there are 14 states that had diphtheria all over the country, if you recall, in August 2023. Now nobody's talking about diphtheria. There are still cases, but it's much lower. Meningitis, it used to be a big issue. Last year, we were the first country in Africa to introduce the pentavalent conjugate meningococcal vaccine, and it stopped that outbreak in its track. Mpox, you hear it in some other places. We have few cases, 40, but we don't have the kinds of explosion. Cholera, 2024, there was massive cholera outbreak. This year, there was proactivity, Ministry of Water Resources, states, CDC, to be sure that we're secure, we protect public health. So those are all tangible areas. And these are what the rest of the world is recognizing. When we went to the high-level forum on universal health coverage in Tokyo, there are only 8 countries that were in this group. Nigeria is one of those. And the government of Japan, World Health Organization, and many, many other global institutions appreciated the reforms that this president is putting in place in health over the last 2 years. Not yet out of the woods. We need to push along as a country, and we need to continue to work towards refining our system to be better in responding to our needs.